Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. I'm going to talk to you about the medication modafinil, or some people call it modafinil. I tend to lean towards modafinil. The topics we're going to cover today: what is modafinil, the common uses and dosage of this medication. We'll discuss the most common side effects as well as other side effects we can see, potential interactions, and some of the warnings associated with modafinil. As with all my videos, informational purposes only, not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. So what is modafinil? It is a central nervous system stimulant. It's a stimulant, like caffeine's a stimulant, modafinil is a stimulant. Of course, they work differently. U.S. brand name Provigil. The exact mechanism of action is unknown. We don't know exactly how it works. We do know that it works. We do know that it increases dopamine in the brain. And for those of you who maybe do some meditation or understand the different brain waves, it's been shown to increase alpha wave activity while decreasing theta and delta. Theta and delta oftentimes we see in sleep or during meditation. It is a stimulant, but it's not related to methylphenidate or amphetamine, so Adderall or Ritalin. It doesn't work in the same way as those medications. In the United States, it is a controlled substance, so you have to be careful there. It is highly controlled, and it needs to be ordered by a physician. It's available in 100 and 200 milligram tablets. What are the uses? The approved uses are narcolepsy, so people who have trouble staying awake during the day. It's used for folks with obstructive sleep apnea that also have problems staying awake during the day. Now, if you're on this, you still need to use like a CPAP machine. You still need quality sleep. This medication does not replace quality sleep, but can promote wakefulness during the day. And shift worker sleep disorder. It's used for those folks that work during the night. This can help them remain wakeful for their jobs. Off-label, we see sometimes it used for ADHD and fatigue related to multiple sclerosis, to cancer, depression, or even Parkinson's disease. This has sometimes been used to help those folks just be more alert and awake during the day. Common dosage is 200 milligrams once a day in the morning. That is the most common dose for this. Now, if you're a shift worker, of course, you're not going to take it in the morning because that's when you're going to bed. You're going to take it 1 hour prior to the shift. 400 milligrams would be the max dose, but that is not used very often at all. It can be taken with or without food, and it is really important that we monitor heart rate and blood pressure. With a stimulant, of course, it's going to stimulate. It has the potential to increase the heart rate as well as increase blood pressure. Most common side effects we kind of see, headaches can occur in 3 out of 10 people who use this. Nausea, about 1 out of 10. Anxiety, stimulants can worsen anxiety. Decreased appetite in about 10% of people who use it. Other side effects can include chest pain, increase in blood pressure as well as heart rate. Again, it's a stimulant. Nervousness, rash, dry mouth, excessive sweating, back pain has been reported, aggressive behavior, and others in the 1% or less category typically. So interactions, one of the biggest ones we want to watch out for is it can reduce the effectiveness of hormonal birth control. So females out there on hormonal birth control, we do need to be mindful that this could reduce the effectiveness of it while you're on it and for up to 1 month after you stop taking the medication. Alcohol can reduce. Of course, you're taking a stimulant. Alcohol is the opposite. So reduce the effectiveness of the modafinil. Other stimulants, you take more stimulants, you run the risk of increased heart rate, increased blood pressure. If you're already at risk of heart attack and stroke, that could increase the risk of those things occurring. So typically, we're not going to want to use this with other stimulants. And of course, it could counteract anxiety treatments. That's one thing. As a pharmacist, I see this more than I care to see. People who have existing anxiety conditions, they're put on a stimulant, and then they need more anxiety medication. Well, these folks just may not be the right population to take these kinds of meds. Of course, that's a conversation you have with your doctor, but that is something to keep in mind. Other drug interactions can occur. There are not a lot of highly common medications that interact with this, but it is always a good idea to go to the same pharmacy and let all your healthcare providers know all the medications you're on so they can screen for interactions. Some of the warnings, rare but very serious rash can occur. Something called Stevens-Johnson syndrome can occur. So if you get a whole body rash, you need to seek medical attention right away. It could be a serious condition. If you have a history of psychosis, depression, or mania, existing psychiatric disorders could be set off by this medication. So you need to be real careful if you have a history of things. You don't need to cause more problems for yourself with this medication. Cardiovascular disease, we talked about that a bit. So it is a stimulant. It can increase the heart rate. It can increase blood pressure. If you're at risk of cardiovascular issues, probably not the best medication for you. It can worsen Tourette syndrome or tics, again being a stimulant. Certain seizure disorders, this could worsen those as well. We need to be cautious in folks with poor kidney or liver function as well. I appreciate you watching. Go ahead and ask questions below. I'd appreciate it if you'd like this video and subscribe to my channel if you like this kind of information. Thanks again for watching.